Awesome, we're live.
Hello everybody, welcome to Personal 20s Active Aging Week. I'm Connie and I'm here with Dr. Secili DeStefano, and we are here in Optimal Motion. She is a physical therapist and she's the owner of this lovely physical therapy clinic. And we are here to talk about all cool things with active aging and arthritis. So I have a few questions we're going to be asking Secili, and if you guys have questions, be sure to write them in on our Facebook Live and we'll try to answer them, okay? So active aging, we are celebrating people 50 and above, getting older and trying to stay active, either stay active or get active. That's why you get to come in for a free trial if you're over 50 at Personal 20. And it's part of the International Council of Active Aging. They've been around for 20 years, and they pick 1 week every year, usually the first week of October, to celebrate this. So we want to age well, we want to age strong, and when we have issues, we want to age with physical therapists that are helping us out. So, Secili, let's talk about arthritis. I know there's like all kinds, but for people like me, 50s, and some of our clients are Personal 20s, 60s, 70s, you know, of all the arthritis, what's the one that's like the most important, should be on my radar?
So thanks, Connie. First of all, I just want to thank you and Personal 20 for coming in and partnering with us to make people healthier and to help people live their lives better so that you can do the things you want to do, you can move better, you can optimize your movement and do the things you want to do every day with your families, your friends, your grandkids, your work, whatever you're doing. So I just want to thank you first for having us and partnering with us in this wonderful endeavor and celebrating this week. So when you go back to arthritis, right? So when we over 50, for example, as you pointed out, the things that you should be worried about, when we talk a little bit about arthritis, we usually think of radiographs, right? We think of x-rays. Well, what does my x-ray look like? Do I have space that's narrowing in there? Is there swelling or inflammation or cracking of my cartilage? And those kinds of things that we start to look at when we go to the doctor with knee pain and he does an x-ray or she, and we're looking there and we're saying, what's going on inside that knee joint? So that's one part, is the radiographs themselves. Are they showing that you have osteoarthritis or changes in the joint space, joint narrowing, those kinds of things? And then the other piece is the symptoms itself. Do you have knee pain, for example? Do you have joint pain? What's going on in the joint itself? Is it hypermobile? Is it swelling? Is there inflammation there? And so those things are not always, this is kind of a really fun fact, those things are not always correlated with one another. So, for example, you might have a really bad x-ray, or your x-ray might be a really high grade, and they might say, oh, you have severe arthritis, but really you don't have that much pain at all. Or you might have a lot of pain and you don't really have that much arthritis. So they're not necessarily one and the same. Just because you have knee pain, for example, doesn't mean that you have a lot of arthritis. Okay. So that's one thing.
Well, so let's take it a step back for somebody like me. I don't have an x-ray, but I'm in my 50s. I have some overuse issues. I like to exercise, and every once in a while I get a twinge of pain. So what is arthritis, first of all?
Well, arthritis is changes in the joint. So narrowing of the joint space itself, like I was indicating, the cracks in the cartilage, the swelling that happens, that in and of itself is the deterioration of the joint. It can occur for a lot of different reasons. It can be biochemical, so it can occur because it changes in your chemistry, like I was alluding to the inflammation that happens in there. It can also be biomechanical, like you were saying, biomechanical changes that occur where you're sort of narrowing the joint more in one area or the other based on some wearing of that joint. So that's what does it. That's what the arthritis is itself, is the narrowing of the joint, or the osteophytes, the bony things that come in there and creep up through the cartilage, that kind of thing.
So some of that wearing, so is that why I've always traditionally heard the word arthritis and thought of my grandparents? It's the wearing as we get older on our joints?
That's what we used to think. We used to think it was just wear and tear, but now we know it's so much more complex than that. And there's so many other factors that can play in to joint changes themselves: biochemistry, biomechanics, anatomy and physiology, like genomics from your family, your lifestyle, environment, all kinds of different things that can play into that.
Okay, great. Okay, well, I have a few other questions because I'm trying to understand more about this arthritis thing. So, first, if our clients are having aches and pains, is the next step to visit a physical therapist to understand if it could be arthritis, or do I actually have to go into the doctor and get the x-rays to determine if it is? What do you advise for that?
Great question, Connie. In the state of Virginia, if you want to come in for a physical therapy appointment, which if you're having aches and pains, you don't necessarily need to go in to see the doctor to get an x-ray. You can come in and have a physical therapy consult evaluation, and we can take a look at the other factors that affect your joints, such as your strength, your range of motion, all of those kinds of things, your mechanics, what do you look like biomechanically, and talk to you a little bit about your lifestyle and your environment and see, do we need to refer you out to somebody for that biochemistry workup that we talked about, or do you need to go in and have an x-ray like we were talking about? So absolutely, you can go straight into a physical therapist and have your aches and pains assessed to see what's causing it, what might be a contributing factor.
Okay, so this is really interesting. So, if I came in and said, look, I'm having this ache and pain with my knee, you would look at what the factors might be. If we want to conclude it's arthritis, do you then send me to the doctor for an x-ray? Is that like how you make the final determination?
Pretty much. It comes together, the diagnosis. So it's not only your radiographs, but also your symptomatology and your clinical evaluation, and including your pain and your strength and your range of motion and your biomechanics. So it combines together. So if you wanted that diagnosis or you needed it for some reason, then yeah, we would collaborate maybe with an orthopedist or another healthcare provider to help you get that assessment if you did need it.
Okay, so then what's next? Imagine I did have the assessment and it's a conclusion. I'm having arthritis in my knee, or maybe I'm having it in my shoulder. I have a lot of overuse issues with my shoulder. That's why I am a patient here at Optimal Motion. It's been great. But let's say it's concluded. What's the next step?
So the next step is, well, then what can we do for those impairments that you're having and the pain that you're having? What can we do to improve your mobility? What can we do to improve your strength? Because oftentimes it goes hand in hand with those things, and your biomechanics of your shoulder. For example, when you came in and we looked at your range of motion, your strength, and your motor control of that shoulder. And then the great thing was that we were also able to kind of partner with P20 to do the exercises to improve those things while you at P20. So exercise is the answer, if you will. I'm kind of jumping ahead, so I won't go any further than that. But basically, we'll just assess those impairments. That's the next step, and then actually start changing them so that you can move your shoulder better. And is it coming from other places? So, for example, with knees, like I was alluding to, we need to look at your hip strength and your foot and what's going on with the rest of your body. Like with your shoulder, we need to look at your neck. We need to look at your upper back and your hips and see what's going on with the rest of your body, not just how you're using your shoulder by itself. And you as a woman, when you ask specifically about you, females are more likely to get osteoarthritis than males.
Well, I did read that. That's not fair. That's discrimination. But
osteoarthritis is discriminating. I know.
Although we do have some clients at Personal 20 that do have osteoarthritis themselves. So I have seen the guys with it too.
Oh, it's true.
And
I'm
their
sure
hips, for example.
And knees too.
Yeah.
But I'm sure it's helped them.
Yeah.
You know.
Well, so the title of this was, arthritis without medication. So I know a lot of us, when we have our issues, we want to treat our symptoms with our doctor and with medication. But how can we treat arthritis or osteoarthritis, particularly without medication?
Great question. We're always trying to be more preventative and look at wellness. What are some non-medicated ways that we can address these kinds of issues? And I think back to your other point, I think looking at the things like, okay, if you're a female, for example, how does that play into, or your hip angle, your shoulder angle, those kinds of things, how does that play into what you're experiencing? The other thing we know is arthritis, if you're overweight, also that can be a contributing factor. So we want to partner with nutritionists and look at your diet as well to make sure that you're getting what you need as far as the energy expenditure. What are you eating and what are you putting out? So that's important too. The other thing is that anxiety can play a part, which is kind of surprising, but in the literature it shows that anxiety can play a part too. So we'll make sure that we're partnering with other experts that can help with that. And we all have been under a lot of stress, I think we can all agree, over the last couple years. So we don't want to forget about that piece, because that can impact our biochemistry, that can make us a little more inflamed in our systems.
You know, that is just so fascinating to think. Is stress or anxiety causing my aches and pains, which maybe got determined that it was arthritis, but maybe that's the cause, and arthritis is one of the symptoms. That's just so fascinating, because in my world of exercise, personal 20 and strength training in particular with EMS, muscles and muscle mass is the foundation of a healthy metabolic system. And a healthy metabolic system with muscles and blood flow, thanks to exercise through the muscles, is also makes a direct impact on our mental health.
Oh, so true.
And it's not just our mental health and our thoughts, it's our brain.
How your brain functions.
And we can have a healthy brain and less anxiety with exercise.
And less joint pain as well. Less arthritis.
Oh my gosh,
with that, right?
It's like all goes together.
It all connects. It all connects. And to your point about the muscle health, muscle weakness is also correlated with osteoarthritis. So we want to keep those muscles really strong and healthy and functioning well. And so that's where P20 can be really helpful, because, and also physical therapy connected together, because you can increase the strength in those muscles without putting unnecessarily stress on those joints. So for example, you're not going to be lifting really heavy weight at maybe biomechanical angles that are not necessarily ideal for you. With P20, you can make it very ideal and very personalized and not put any unnecessary stress on the joints. So that's what I like about it. A lot of my patients have had good success. And hypermobility has also been shown in these joints. If joints are hypermobile, there's a greater risk of arthritis. And so this helps, for example, my patients who have joints that are hypermobile, they've been working out with Personal 20 and they've been able to control those joints better in a much more controlled environment. So they're, again, less at risk of that osteoarthritis.
So that's also fascinating. So I know who these patients are. They're wonderful. They've been exercising with the EMS. We were able to put it together. So actually a little history. At Personal 20, we have the P20 functional program. We've been able to offer it both here at Optimal Motion, and when we haven't been able to, we still partner with Optimal Motion. So if we've had patients that were recommended, we make sure we can take the program and talk back with the physical therapist to know, okay, what do you want me to have in mind when I'm training them for the exercise? So that's worked really well. And we were so happy to see them get stronger, which is what we do. But I didn't know we were actually maybe potentially helping them benefit, reducing their risk of arthritis.
Exactly. Much less risk of arthritis. And our pilot data that we've been doing together in these clients is very good. Our outcomes are very good. Improving strength, range of motion. Every single one of our patients, 100% of the clients that we've been sharing, have shown this potential. So we're very excited about that.
So prevention. Because I'm an active ager, doing my strength training, going for my walks, I like to do a bit of cycle classes, etc. Am I reducing my risk for having arthritis, or is arthritis just something I'm going to have one day when I'm older, 70, 80?
Well, maybe you're going to have arthritis, but you don't have to have pain, because those aren't correlated. And so it's this wonderful meshing of preventing all this movement that you're doing. The research shows that movement is the answer. Being sedentary actually makes us more at risk for more osteoarthritis, whereas moving makes us less at risk. Sometimes we have this fear that, oh, I'm afraid to move because I'm afraid I'm going to hurt myself. And it's understandable to have that fear, but the research says that moving actually decreases our risk of osteoarthritis. So movement is the answer. Working on all this great exercise that you're doing, the strength training and the walking, and also balance training is another thing. We do here at Optimal Motion, as well as P20, working on your balance. That can help reduce falls as we age, but also with the osteoarthritis too.
Fascinating. So that's really good. So I hope that's helpful and educational and supportive. We don't have to fall victim to arthritis, or if we do get it, it doesn't have to be painful. The name of the game is keep your body strong, keep your brain strong, which still comes from muscle mass. So you need to have muscles. You need to age well with muscles. You don't have to lose it unless you don't use it. So if you want to try Personal 20 and EMS, this week, Active Aging Week, so we're celebrating anybody over 50 can come in and have a free trial. And I just have to say, if you do have aches and pains and you're a little nervous about how to start or where to start, it is a joint-friendly program, but you might want to reach out to a professional first, like physical therapy. I personally believe everybody benefits from physical therapy. We walk around with a little bit of our aches and pains and we think, oh, I'm only going to see a physical therapist if it's assigned by my doctor because I'm in big pain. But you know what? If you go in sooner and you take care, I regret I didn't go in sooner for my own personal aches and pains. So we just always want to encourage people. You don't have to live with pain. Physical therapy can help. And you don't have to live without muscles because you're never too old to get stronger.
That's right.
And we have plenty of science that proves that too. And the science is fascinating. It's every day there's more and more research. So the more muscles you have, the better metabolic system you're going to have, the better immune system you're going to have, the happier you're going to be, and you're just going to live well. So consider that investment in yourself. Exercise and get strong. Yes?
Thank you.
Okay. Thank you, everyone.
It was great meeting with you today.
Bye.